Now, the second part of the scan, of the guidelines, as I mentioned before, is focused on the targeted neurosonography. You all know that the transvaginal approach is the preferred method due to better resolution. You get much closer to the structures of interest. So you have a much better anatomic detailing and higher resolution. If technically not feasible and the fetus is in a non-vertex presentation, you should try to use the newer generation of the linear transabdominal transducer, which provides you with much higher resolution imaging. Now, the neurosonography is a screening scan performed by the multiplanar assessment, both the coronal and the sagittal views, both from the anterior and the posterior approach, so you can have a comprehensive image of the entire brain if performed by an expert sonographer. So from the technical point of view, the coronal views of the brain should be performed from anterior to a posterior sweep. These are the key images, but actually you have to remember that you're not looking for a specific image, you're looking for a dynamic sweep through the brain, because not all the pathologies are located 100% inside one of these four images. So this is a dynamic sweep through the brain by placing the transducer on the anterior fontanelle. You take a look at the anterior lobes and then continue to the anterior complex, cavum septi pellucidi, and the crossing fibers of the corpus callosum, and then you continue all the way to the posterior fontanelle, placing your probe on the posterior fontanelle for the coronal images of the cerebellum, vermis, and the occipital horns. Now, as I mentioned before, the brain constantly changes appearance, so you have to remember that sulcation is a phenomenon of the brain which appears later on in pregnancy, mostly in the second half of pregnancy or late in the second half of pregnancy. And for example, here if you compare the two anterior coronal images, you see that mid-pregnancy the hemispheres are completely smooth as compared to the more developed sulci, and of course the olfactory sulci should be observed, which starts to bulge out at around 25-26 weeks of pregnancy. Now, what about the mid-sagittal image of the brain? So the mid-sagittal image of the brain allows you to have a nice imaging of the entire components of the corpus callosum and third ventricle and cavum septi pellucidi, but then you should slide parasagittal through both hemispheres, as you can see here in the illustration. And once you slide parasagittal, you should be gaining a nice cross section through the hemisphere, and then you should evaluate the brain parenchyma itself, the periventricular area, the normality and smoothness of the walls of the lateral ventricles, the choral plexus, and all the way to the temporal horn and temporal lobe, and the operculization, the closure of the sylvian fissures. Now, regarding the sagittal images, so what I showed you before is focused on the supratentorial structure, but actually, if you want to study the brainstem, vermis, and the posterior fossa, which are the derivatives of the midbrain and hindbrain, you should place your probe on the posterior fontanelle. In this way, you get much closer to the region of interest, and also the beam is perpendicular, so you have most of the ultrasound beam is being reflected back to the transducer for the optimal imaging of these areas. And here you should be able to recognize the tectum, tegmentum, and the thin aqueduct filled with fluid between them, the normal appearance of the fastidium of the fourth ventricle, the vermis with its primary and sometimes the secondary fissures also can be obtained, of course the fluid in the posterior fossa, and the shape of the brainstem. Now, regarding the fetal spine, as I mentioned before, you actually should look at the spine again in three complementary angles or views: the axial views, in which you go from the cervix all the way to the sacral area, crossing through different sections of the different vertebra, and they change as you go down from cervical area to the sacral area, and should be able to recognize these changes, and the three ossification test centers and the spinal cord in the middle, and then rotate to the mid-sagittal image. And this image is obtainable due to the fact that the primary ossification centers at the posterior side or the dorsal surface are not closed yet, so the ultrasound beam can penetrate between the posterior arches of the vertebra, so you can locate, first of all, appreciate the normality and the regularity and the fullness of the skin covering the back, the shape and the position and the height of the conus medullaris, and all the bodies of the vertebra. And then, not less importantly, is the coronal image crossing through the bodies of the vertebra, in which you can rule out any abnormal angulation, hemivertebra, etc. So all these three of these planes should be complementary to each other. Now, 3D ultrasound is another great tool which you should know and implement in your exams. The 3D ultrasound allows you to perform a multiplanar imaging of the brain. So once you acquire a volume in the optimal position through the anterior fontanelle, this provides you first to apply some post-processing tools such as a VCI, in which you can have a better detailing and better contrasted images with nicer details. And also you may correct some minor malalignments for optimal imaging and measurements, for example, of the corpus callosum and the opening or closure of the cilia fissure and the operculization. Another tool in which you should and may be using for the 3D imaging is the surface rendering, and this is a very helpful tool for the evaluation of the spine, and you can scroll in and out in the depth of the volume to evaluate the vertebra at different levels. Now, as I mentioned before, quite a new concept which is becoming more and more familiar and more used among sonographers is the early neurosonographers, and there's an increasing trend to perform earlier evaluations of the fetus, including neurosonography. Now, the recommended approach should be the transvaginal ultrasound because, as I mentioned before, it provides much higher detailing and resolution. But again, remember that a normal neurosonography during early pregnancy does not rule out later appearing malformation, and this must be followed up by an examination after 20 weeks of gestation. Now, at the late first trimester, the approach of choice should be an axial plane view, as I showed you here before. And once you obtain your axial images, you should acquire a volume, and then on this volume, you may reconstruct both the mid-sagittal image and the coronal images. And as I showed you before, the aqueduct is quite large and pronounced during this during 12 or 13 weeks. You should be able to recognize the echogenic choroid plexus of the fourth ventricle, and you will hear a great talk about specifically this subject later on in our course. And again, you should be able to recognize the cerebellar hemispheres riding on top of the choroid plexus, which is riding on top the physiologic Blake and the foramen of Magendie. What about neurosonography between 14 and 17 weeks? Now, this is becoming this data is becoming recently more and more published, so you should be able to recognize the developing midline after 14 weeks, and actually 15-16 weeks you should be able to recognize the budding, the beginning of the corpus callosum here in the midline. Remember that the cavum septi pellucidum is still not lucent and not filled with fluid, but it's filled with cells at this level, and this is completely normal. This will become more clear at about 18-19 weeks of gestation. Sometimes you see in approximately 50% of fetuses, you will recognize this fluid-filled structure between these two hemispheres. And if you perform a multiplanar imaging, you see that this fluid is located outside the third ventricle, dorsal to the roof of the third ventricle, and this is a normal physiologic cavum veli interpositi, which will absorb and disappear later on during pregnancy. So bear in mind this anatomy, it's there, it is present, and if you perform the correct technique, you should be able to perform a complete neurosonography also after 14 gestational weeks. So for my last slide, I wish to, and this is the good opportunity to give a big thank you to all the people that were involved, led by Professor Dario Palatini and Professor Gustavo Maliger, which did a fantastic job in compiling these two great parts of the guidelines, and I hope you will find them useful and a great tool to implement in your daily practice and